So we were talking about the role of school as an engaging, inclusive environment. We were talking about the attitudinal barriers. We were talking about the role of teachers, both general and special teachers, in caring or in considering a child with a special problem or include them into the classroom. Now the modifications that should be made in the school environment is very, very important. That every child should have an access to each and every place in the school or in the educational space, even in school or colleges or in the universities. Each and every child should have the access to the libraries, laboratories and other centers where these children are learning as part of their normal curriculum. As we all know, teachers, school or college or education system is not just for cognitive development or improving the knowledge of that particular child. It is to learn socialization, it is to learn even life, that I mentioned earlier. Now, we were discussing about school in the first part. Now we are coming to the second part of the presentation, that is the role of family towards inclusive environment. As we all know, parents are the first teachers of every child. So how a child is learning? We all think that we should tell them what they should do. What are the rights and the wrong, and what are the problems and the issues, and what they should take care of when they enter into the society or into their own life. So we are all very much worried about our children. We think that if we teach them, we tell them everything, the child will learn and he can be a healthy person in the community. Healthy means mentally, physically and socially healthy person. But is that true? That we need to think, what is the real, what is the way we should help a child to include into the society? So at first, the child is seeing her mother, his or her mother first time, and the first bond a child is forming with their mother. So mother is a very, very important person in a child's life, because a physical contact is there and an emotional discourse is there, emotional transmission is there, and this child is learning a lot of things through a mother's behaviors, emotions, actions. You might have noticed as younger children in the age of just a newborn baby smiles at our mother in a particular time. If that developmental stages is not properly developed, the child will have some problem that we assume. The developmental milestones a child should achieve in each stage of life, and there is a proper involvement of the parents and the family should be there if this child is having a problem particularly. If a child with a differently abled child should get proper scientific care for this to engage them into the society. But what happens is, most of the parents may not accept that their child have a problem. If a child is diagnosed with autism or a child diagnosed with intellectual disabilities, the first part is the denial that my child is not having any problem. That denial itself can hinder the growth of the child. How? Because that scientific care may not be given to that particular child. So if you support a child with any problem, that can help the child to grow better. Like he can accommodate his capabilities with some skills. So that is the point I wanted to make. So first thing is, you should get proper advice, proper learning beforehand. Even someone is planning to have a child, beforehand they have to understand what are the developmental stages of a child in the womb and when he is out of the womb. Developmental stages and the developmental milestones, and we all know that in our community how many parents are aware of the developmental milestones of a child? No, most of them are not knowing about it. If they are poor family, they are from poor families, they are not at all aware of the developmental milestones or how to develop the skills of a child who is having some problem. So the first thing is getting awareness and supporting the child with a particular disability. So what all points we need to understand to support a child, to include him or her into the society? First thing, if they need any support services like medical care, psychological care, or a care, speech therapy or physiotherapy, or whatever support a child needs, that must be get accessible for each and every family, or that way the family should move. And if we all know that 80% of the disabilities can be avoided if we are if our intervention is proper on proper time. I mean, if we provide early education to the parents, 80% of the disabilities can be provided or can be prevented. That is some of the studies shows that. So if you provide a child with cerebral palsy at the early ages, say below 3 years of age, we can considerably improve the performance or the daily living skills of that particular child. So that to provide support services, early intervention services is very necessary. So as professionals in the field of disability and rehabilitation, our primary role is to educate the parents who are not aware of these disabilities and the support services the parents should access at the early stages. And even doctors, we might know that doctors are not much communicating with the families. I mean, a gynecologist, if a lady is pregnant, she or he may not get time to interact with the mother, that your child can have these type of problems, you must understand these type of things during your pregnancy, you must take care of your nutrition. No, in a developing country like India, you cannot expect such a detailed assessment and evaluation from a gynecologist, or after a child, a pediatrician. Let us come to a pediatrician. You may not believe that most of the doctors in general hospitals or in primary care centers or in interacting with the parents are not aware of many of the disabilities. I have personal knowledge about it, that many of the doctors, they are not learning much about disabilities. They are just learning about medical aspect of disability, and we all know that the medical aspect is not the only thing that we need to help the child in developing as a complete or developing as a person who can perform better. We need other services too, and you cannot expect a pediatrician to explain all these things. So we must get that much of knowledge and get that much of initiation to train the parents in this particular area. Now coming to school or teaching children with special needs. Considerably, our topic is we are focusing on children with special needs. If the parent or the family is not supporting the child properly at home, it will be very difficult for him to achieve what he really can. That is a very big issue that happens in every word. And the interacting with the teachers is very, very crucial when you consider a child with special abilities. Interacting with the parents, interacting with the teachers, special teachers and other support service providers like physiotherapy, speech therapy, and the parent should understand these type of therapies should be given at home, and you should not over support your child. You should give proper care for your child. These points must be understood. As rehabilitation professionals, as people who are interested in topic like inclusive learning environment, may be aware of all these factors. But our community, when you going to the community, to the grassroots level, whether they are aware of all these aspects. So, it is very, very important to disseminate knowledge to the grassroots level, how to handle a child with disability at home and how to engage him into the society, how to take him to this community. That is another crucial point we need to understand. And coming to the transition, and that is the most difficult time a family experiences. Transition from school to work. Most of the parents have that problem. That means they are very much anxious about the future of their child. Like, if I passed away, then what will happen to my child? Even normal, even parents who is having normal children has that problem, that tension and anxiety. And what about the parents of children with disabilities? See, most of the parents or the caregivers in the family are providing round the clock care to the child. So, the mental health of the parent and the family can be affected. And also we must think about the siblings in the family, siblings of the person of the child with the disability, and their problems is very much very well studied. Many of the studies, if you go to Google Scholar or PubMed or Medley, you can find a lot of studies on this psychological, emotional aspect of siblings of children with the disabilities. So, these problems all should be addressed and help the parent to engage their child into the community. And out of the school care is is another important topic. Out of the school care means physical care is there. If a child having difficulties with locomotor disabilities or cerebral palsy or some neurological conditions or intellectual disabilities, self-care services also a parent sometimes have to do. So, and other things, supporting educational services. So, role of the family, we were discussing role of the family of a child with special needs. The first thing is, as I told, early identification of the disability of the disability. That is first thing we need to educate families. Early identification itself help inclusion. How? See, if a child gets identified early, he should be provided with support services that will help him to communicate, to bridge the gap between the normal people and this child with disabilities. In severe cases, it may be a bit difficult, but still you can make him engage in the community. Whatever the disability is, that child has a role in the community. So, that can be identified and provided to the child if you diagnose the child's disability as early as possible. And parents should not get disturbed by the responsibilities of looking after them. And as we all know, the round the clock care 24/7, parents should invest their time. So, that will lead to very severe emotional psychological problems to the parents and the family members. So, it should not feel like that. That type of support services should be provided by the society. That when we discussing about society, that points can be added. And parents should understand the meaning of inclusion. So, inclusion means your child also have the same opportunity, the same rights as a normal child. So, that is what a parent should understand. My child, even if he is having some difficulty, he is also equal opportunity to get educated, equal opportunity to equal right to get educated, equal right to get the resources of the society. So, that feeling is the first thing a parent should have. So, and understand the meaning of inclusion, and providing support services, the child can be included in the community, and that itself can eliminate the despair that happens due to the disability of the child. And parents are responsible to generate income and provide financial support for child's living costs and related payments. Sometimes that is the most crucial point. The financial support should be provided by the family. So that may lead to some severe economic problems, and that also can be addressed or should be addressed by the community. Community means the state and all support services that is provided by the society that we will discuss. Now, parents have an affectionate responsibility to show and share love, care, emotional feelings and companionship with their children. I have to share an experience which I had during my travel in a train once. I entered into the train and in the opposite side of my seat there was a family, and they got 2 children. They were twins, both having severe cerebral palsy, and I was looking at the parents. They seemed very happy, very active. May not be happy, but they seemed very happy. They were very active and they were engaging the children all the time. And I was talking to them, and they were all both were alighting in the station which I have to. So I was asking them, what happened to your child? And he said, I was taking him to the hospital here, so I am going back home. I am a auto rickshaw driver, and I am taking care of my child. And these parents were very happily talking about the activities of their child. See, when you talk about your children, that my child sings, my child dances, my child does that, does this, these type of things, nothing, these parent cannot say anything like that. But he says that no, look at him, he is laughing he understands what you are saying, and he is very happy with that. See, a mild change or mild response of the child make these parents very happy. So we must be empathetic. We must place ourselves into that particular place. So why I am saying this, it is very, very difficult to show that you are happy, but the parents of children with disabilities does that. I hope some of the parents are also listening to me through this video, and I can understand what is going on in your mind at this time. It is very difficult, I know that. It is very difficult to show that you are happy and you are taking care of your child and you are not frustrated, you are not worried, you are not unhappy. So these are very difficult. If you feel to cry, a parent should ventilate their feelings. So that why these parents should ventilate their feelings? Because if the parent is not healthy mentally, physically and financially, the child also can have to suffer. You might have heard that in an airplane travel, the crew will announce something, that if something happens, something unexpected crash or something happens, an oxygen mask will flow down, and you should never put it in your child's mouth if you are taking your child with you. You should wear it yourself first, then only you should wear to your child, because if you suffocate, your child definitely will suffer. So you must keep yourself safe first, then only you can support those who need your support. This is very important. That's why we should as professionals, as teachers, as parents, we should understand we must be very healthy in the sense physical health, mental health, mental or psychological health and social well-being. Everything should be needed as parents. So parents ensures for providing congenial environment to children with disabilities at home. So this child should be engaged in their house, providing happy environment for them. Parents should accept the limitations of their child. What happens is, in many of the cases the parents try to show that my child is something very special and he is having that much skills and over expects something from the child, and sometimes boast that my child does this, that, etc. So that will provide very difficult or that will affect the child's psychological health or self-esteem. That is the right point. The self-esteem can be affected. If you say that my child is that much good and he is having that much abilities, the child feels that I don't have any abilities like as my mom says. So it may affect his self-esteem. That's why we say that parents should accept the limitations of the child. And parents should determine the strengths and needs of their child. We should try to understand the strength of the child and we should provide support for as per their weaknesses. And the most important point that most of us may not do is providing your quality time to your child. No, many of the parents who are here, who are listening to me, you just think how much time I am giving to my child, or I was giving to my child when my child is young. No, many of the parents may not be able to provide quality time. So what is the reason? What is what we can do then? You should communicate with your child that I have this much time to interact with you. That communication should be there. We feel that we try to make our time for our child, then it will be very difficult for you and both the child and you. So they feel that I am not important for my parents. No, you have to tell them that my son or daughter, I don't have time, I have to do this much of work. After that I'll come to you, sorry and excuse me, I'll come. So this child will understand. This is the way I communicate with my kid, and it works. Definitely it works. And if when I leave home, I will tell him, Ishan, I will be late. I will be coming by 6 o'clock or 7 o'clock, or I will not be coming today, I will come tomorrow. And what most of the parents does is, they will leave without saying that I am leaving. They says that I am just going the other side of the house, and they leave. And the child will not believe further the parents. At first the child may not agree with you, but later the child can understand that you will not deceive your child. And making that feeling in your child is very, very important. That is the only way to make him believe the people around them. If your parents deceives you, then whom they will trust? So tell them true facts. Whatever the fact, you tell them correctly. At first they may feel agitated, they may feel worried, they may cry, but don't care, but never lie to them. That is the way we have to interact with the child. And for a person with or children with disability too, we don't think that my child cannot understand what I am saying. Definitely they will understand. Sometimes emotion speaks louder than what you are saying by words. So your emotion can communicate a lot to your child. So parents should spend quality time with with them, and parents should involve in the academic development of their children. Sometimes the parents may not be educated, but they can be with them while they are learning, or they can help the child to get learning or get their books or something. In some way you have to support your child. Parents should involve in the academic development of the child. So academic activities they are doing. Sometimes the parents at home may not be much educated. So how they can support their child? Just be with them and just ask them Can you could you learn what are you learning, what is your teacher teaching you, like that type of questions itself help them to get involved in learning. So they feel that my parent is also interested in my learning and they support me, and just help them or give them positive regards. Unconditional positive regard is a psychological term that we used to use in our in the educational system also. In counseling and all, unconditional positive regard in counseling, that we are using that term, and it is important for children too. You must unconditionally give them positive regards, so that will help them to learn better and to become good citizens later. And parents should try to provide stress-free environment at home. See, the issues of the parents can hinder the development of the child. So, what you should understand is, providing a stress-free environment to the child is most crucial for his or her complete development. Parents should help their children for inculcating positive attitude towards learning. And parents need to enjoy and be excited about what their children are learning day by day. That is that I was saying. Parents should get excited. Our parents should show their excitement in the development of their child. So these points will help the child to get engaged in their learning. So, and that will help him to learn better and to involve into the classroom. In short, family is the most important factor in a child's life, because as we all know, a family is the first place where a child is placed, and from there the child is learning. And how this child is learning is imitating the parent, imitating the family members. You might have seen that the younger children at their younger ages, they try to wear the shoes of their parents, and they try to wear the dress of their parents. They are all trying to imitate what you are doing or what the adults doing in the family. So these are all the points we have to understand. A child is imitating their own family members to live, and mistakes can happen, failures can happen, and the family should support how to handle a failure, how to handle or how to correct a mistake. And what in a family the people usually does is, they will not pardon for mistake, and they will beat the child, sometimes they will curse the child and misbehave with the child, and that will not help the child to develop into a proper personality. And for children with disabilities also, this is very, very important. You have to consider that child as an individual, as a very dignity, as an individual with a very high dignity, and we have to respect and treat them as they that way. That is all about the family and the parents, the role of family to make an inclusive environment for children with special needs. That's all.